Good afternoon, everybody. Welcome to this afternoon's webinar. Sharice Pope from Better Health Together, and we can see that we've got quite a few participants for right after the first of the new year, so thank you all very much for joining us. We wanted to do a webinar as we know that all of you are working through your transformation plans for the January 31st submittal, and we wanted to have some dedicated time to talk about not only the transformation plan if you had questions, but also support you with the aim statements and the milestones. And so we're happy to do that and happy to have you joining us. I would like to have the folks that are going to be presenting with us introduce themselves. So at Better Health Together, you have myself, Sharice Pope, and our Senior Program Manager, Sarah Bullock-Dorn, and Dr. Ron Stock. Would you mind just giving a little hello and introduction to yourself, please?
Sure. Good afternoon. Can you hear me, Sharice?
Yes, thank you.
Yeah, sure. Great. Hi. Good afternoon, everyone. I'm Ron Stock. I'm a clinical consultant to Better Health Together, and will be supporting the team this coming year. And I'm a family physician and geriatrician by training.
Great. Thank you, Dr. Stock. Kathy Kaufman, would you mind saying a pleasantry or two this afternoon?
Hi, everybody. I'm Kathy Kaufman. I'm a consultant. I've been working with the BHT team for the last year and a half or so through Health Management Associates. I'm based here in Portland, Oregon.
Great. Thank you, Kathy. And Shauna, would you mind saying a good afternoon?
Hi, everyone. This is Shauna Petchel. I'm with the Center for Outcomes Research and Education at Providence Health System, and also based in Portland, Oregon. Nice to be here with you all.
Great. Thank you, Shauna. I appreciate that. So, Sarah, do you mind? Let's jump right in and get going. So today's webinar, we're really, again, just going to focus on the process and the timeline. We want to do a walkover or a quick look at the final template, and then spend some specific time around writing effective aim statements and the milestones, because those will be key components for your contracts, your pay for performance contracts coming up at the end of January. And then answer and leave time for any questions that you folks have as well. So that is the agenda for this afternoon. And Sarah? So the overview of the process again, this webinar is specifically aimed for the January cohort, but if you're part of the August cohort, you're more than welcome to listen, and appreciate you guys joining us if you are part of that. So we recognize that the January cohort will be asked to submit their revised transformation plans January 31st of this month. At that time, we will be reviewing for completeness and making sure that any gaps or questions identified in your feedback sessions have been addressed. And then we'll be looking at milestones and timelines in the final plans, because those will be incorporated into your partner and provider implementation contracts. For the August folks, your timeline is a little bit different, and we will be supporting you to revise your templates through July 31st, and then hopefully entering into pay for performance contracts in August of 2019. So just really quickly, I just wanted to touch base on the learning cohorts, because I'm sure there's a lot of questions coming up for those. And again, if you go on our website, we do have a specific learning cohorts page there with a lot of information that will continue to get populated as we go forward through the year. And there will be a lot of resources there for you as well. So the purpose of the learning cohorts, though, just one more time, is to really support providers and organizations either implementing or getting ready to implement their transformation plans. And when we were looking at the transformation plan responses across the board, not only did providers indicate those areas of gaps or needs or challenges that they had, but then as reviewers, we were also able to identify some as well. So we really are working on putting together a learning cohort series that addresses those gaps and challenges that were identified that each of you need to support your going forward through 2019 so that you can meet your measures and be successful. For January, as you can see, we were going to kick off on the 24th, and the topic for the January 24th learning cohort will be centered around change management, principles of measurement-based behavioral health care, evidence-based and strategies for whole person care, and then really looking at readiness checklists. We will be privileged to have Dr. Ron Stock with us that day, as well as Ann Shields from the University of Washington AIM Center. So we are excited about that. Both cohorts will be with us for that day, January and August, and we're really looking forward to kicking off a successful year with the learning cohorts. Again, the website is right there for you if you want to take a look at that. And if you have any questions throughout the year, please let us know. One key thing to keep in mind when you go on that learning cohort website, you will find the attendance policy, which we need signed and back to us by January 24th, as well as you'll find an outline for the first quarter of topics that we will be addressing and supporting. And then you can also take a look, in case you haven't already, about the availability of funding for participation. So all that information is on that website.
Yes, and I will say there is a typo in the slides here. The correct website is, I sent it in the chat. It should be learning, spelled correctly with an I, dash cohorts. So that's in the chat box. And we'll be sending it to you in many, many emails as well.
Yeah, and you know, one strength of BHT is we love to send emails. So, but we also love to hear back from any of you if you have questions. So, all right, well, let's jump into the overview of the transformation plan template. So one of our big initiatives with the revised transformation plan was to make it much shorter and as simple as possible, and just get the information that we really felt we needed to be able to enter into a contract with each of you folks. So I hope that we accomplished that. We did send out the template prior to distributing it across our system of care to some folks who gave us some really relevant and good feedback. So thank you to a number of you who we asked to give us feedback and really provided us with some great insight. So we went down to 8 pages, which I think is significantly better than where we started. And as you can tell, and also I would like to say that we tried to pre-populate those fields from the original transformation plan that we felt would still be applicable to your current or revised transformation plan. But as a few of you have already asked, you can absolutely go in and change any of the information that we pre-populated. There were a couple folks who've already started working on your revised template and wanted to change your aim statement. So yes, you can absolutely do that. We were merely trying to be helpful as we go through this process. Sarah, you want to move us along here? As you'll see, we are addressing the same sections that we did in your initial transformation plan. So again, starting off with bidirectional integration of care. Sarah, you want to go forward? And some feedback or some helpful feedback for you is, check those boxes that are directly related to the work that you are proposing in the plan. So as you look at the BRIA and collaborative care models and you look at your plan, please mark those that are most applicable to what you're proposing. And again, looking for target populations, who are you planning to serve, characteristics, conditions, and then give a brief, what we call an elevator speech description of your overall project description. And so with that, again, our main focus for today is to talk about and give support around aim statements, as well as milestones. And so again, we have Dr. Ron Stock with us, who's going to delve into aim statements and going to make this so clear for all of us that we will be writing these for the rest of our lives. Is that correct, Dr. Stock?
I certainly hope so. Can you hear me okay?
Thank you.
I'm unmuted, so hopefully folks will be able to hear me. Well, thanks, and good afternoon. I think hopefully the folks that are on the call have probably realized that the importance of the aim statements. We certainly spent a little bit of time on all of the feedback sessions with folks around the aim statement. So hopefully this will begin to get you to think about how you write your aim statements, and hopefully begin to standardize sort of over the organizations about how to do that. Really, the aim statements, as you can see in this definition here, is a clear, explicit summary of what you hope to do. It really is the centerpiece around answering the quality improvement methodology question of what are you really trying to accomplish. So successful improvement and certainly best practice requires setting aims that are really clear, that an organization really will not or won't improve without a clear and intentional plan, obviously, and the aim statement is a tool that gets everybody on the same page about what you intend to do. This quote, and then there's a link here about writing an aim statement. If you put Google aim statements, you're going to find a large number of sites where it will describe to you about aim statements. They're pretty much all the same. We like this one from the National Institute for Children's Health Quality. But the aim statement really needs to be time specific and measurable, and clearly define the population that you want to impact. You want to go to the next statement? Before I go there, I wanted to tell you, recite a quote from the Institute for Healthcare Improvement around writing aims. That the art of writing an effective aim statement is finding a focus. And much of this, what I would say in terms of feedback to many of the aims that we saw in the first round of proposals, is there really a need to begin to focus that inspires the hearts and minds of folks doing the work. It provokes action, it provides guidance, and it also sets expectations while avoiding some unintended consequences. And one of the biggest unintended consequences is that of sort of gaming the system. But it really sort of lays out the framework of the work that needs to be done. I like this grid, and I know that some of the organizations that made proposals and wrote aim statements in the first round of their proposals, you actually took this table and filled in the blanks. And I'd encourage you to think about doing this. And in a few minutes here, I've got a number of examples that you can see where we filled in this table and how you can use this to really describe what you want to accomplish. But it really it reminds you that you need to know what you want to do. What is it that you're trying to accomplish, for whom you want to do it, and really who is the population you want to impact. Some people think that's a pretty easy thing. You just describe the folks that you take care of. But for many of these projects, initially and maybe through the future, you want to be really definitive about who you want to be impacted by this. And as you look at the examples, we can talk a little bit more about that. I think setting a timeline is really important. It really gets people to move forward and to keep the project going forward. And then how much? How are you going to know whether you're really accomplishing what you aim to accomplish? And then finally, it's just a statement of the full statement of the aim statement. And again, the examples will run through that. Next slide. So really, the milestones is the how part of how you're going to accomplish these aims, and what are the key steps to get there. Sarah, can you go to the next slide? When I looked at the slides this afternoon, I thought maybe this is a slide that we should start with before we go to the definition. But I really see milestones as really sort of the steps in a ladder that takes you to the aim, which is, you know, up there in, I guess you could say maybe heaven in this part, but what is it? Whatever you're trying to accomplish is your aim, but there are steps in which you take. And the simplest thing that I think about in terms of milestones is that if you want to graduate from college, there are certain things that you have to accomplish. Number one, you need to graduate from high school. Number two, you need to, you know, pick a college. Number three, you need to finish your requirements in college, and number four, you graduate. So there's, you know, there are certain milestones that either happen or they don't happen. And the thing about milestone is that it's written in such a way that you can say, yes, I did that, or no, it isn't completed. So it's a binary sort of yes, no answer of whether you've accomplished this. Why don't you go back to the previous slide if you can. And so milestones are typically written with three kinds of ideas in mind. First of all, it's as you go through the project to reach the aim, is that there are certain events that are key that need to occur in order to reach that aim. In an event kind of example, an example of this would be sort of completion of training. There's a certain amount of folks that need to be trained around a certain topic, and that either happens and gets accomplished or it doesn't. That there may be hiring of an individual that may make a difference in terms of whether you're going to be successful or not. And that might be hiring a care manager, or it might be hiring a clinician who has buprenorphine waiver training or something like that. Those are specific events that happen, that either happen or don't happen, and that can be a milestone. The second is a key project task that might be required. As I look through a number of the proposals, a number of folks have a particular measure that they want to accomplish. Well, sometimes in a measure you need to establish a baseline, and that takes time and activities in order to establish a baseline measure. So that would be an example of a task that somebody would need to do to answer a question about how to move forward. Another example, I know a number of folks are interested in IT and buying software or hardware, and so a milestone might be to do your due diligence around evaluating which is the best tool. That would be, once you've done that, that would be a milestone that you would want to write down. The third is a deliverable. So many of you might want to accomplish a certain measure. And in those situations, sometimes you know you can't get to that goal immediately, but you might, through a pilot or through after say 6 months rather than a year, you might want to reach like half of that goal or that measure. Again, that would be a milestone that at maybe after 2 years you would want to increase your volume of MAT clientele to by 50%. But in 1 year, you want to at least increase it by 25%. So that would be an example of a milestone that you would want to accomplish in a certain time. What I list down below are milestones. They tend to be specific. They're observable. You need to be realistic about it. It's very easy to write milestones that are sometimes just really easy to accomplish, and you don't want that. You want to be able to sort of what we call stretching that milestone or accomplishment, but at the same time you don't want to make it too much of a reach for you to be able to do it. That it's not realistic that you can do that. I think the nice thing about milestones is that it makes it really clear to your organization and your staff and hopefully your leadership about what you want to accomplish and the timeline in order to make that happen. So let's start with some examples, and I'll start with this one example. Let's go to the next slide. And okay, remind you of the ladder and the steps to get to that aim. So this is I picked a couple of examples from ones that were reported in the transformation plans, and I took out the names to protect the innocent. But somebody from this organization may recognize this particular aim. And I put it into the table so that you get an idea about how to use this. But again, so this is and there were a number of aims in the plans around developing a patient registry, and I think this is a good one to at least begin to look at. So what here is developing a patient registry that help them risk stratify patients, particularly those who had mental health and physical health conditions, and then to facilitate then or create a process to treat or take care of them in a population health approach. What I would just say as an aside, if I were spending some time with this organization, and just to point out that there would need to be some more definition about, well, what's your definition of a mental health or a serious mental illness condition. That really gets to the population question about for whom, and then what are the chronic conditions that you would want to address. And so this is something you might want to think about either including in this example in your next round of developing this aim, or you might want to say at this point we don't know, but as we pull our team together, these are definitions that we're definitely going to need to review. How much? The goal here is that at least 65% enrolled in physical health care for these folks that have both a serious mental illness and one or more chronic conditions. And then the last sort of the full aim statement you can see there is really pulling together those sort of four components of an aim statement and putting it into one statement. Next slide. So so what are the milestones? How are you going to accomplish this particular aim? Well, I don't know where this organization is at in terms of this particular aim, but I took a stab at sort of, if I were looking at this from up front as a project going forward, these would be the kind of milestones I would think about. So first of all, is establishing a multidisciplinary team. Many times organizations don't have a team, but I think this is one where a team that had a charter, which would be another tool you might want to use, would be helpful by a certain time. I think although there's the goal of having 65% of folks have connections with chronic care disease, I think it's important that also look at well, what's the baseline? What are we currently doing? So establishing a baseline value is important. Hiring a care manager or coordinator, or this might even be retraining somebody that already exists in the practice to manage the registry. So again, that would be a milestone. See that as a key component to this. Many organizations don't have a registry. I don't know about this one, but certainly an organization that didn't already have a registry, one of the milestones would be to choose one. There are many of them out there, but to choose one that would meet their needs and that would need to be established before you started populating it. And then the whole process around developing a registry, and then how are you actually going to, how you're going to train staff, how are people going to be populated, how are you going to use that and review it over time. There's a whole process around that. But instead of the individual steps or activities around that, your milestone is establishing that process that you're going to at least maybe pilot for a period of time. A care compact might be in place, certainly if you're collaborating with primary care clinics for this. And then the last bullet really addresses sort of how are you accomplishing or making progress in terms of your deliverable. So you might say that, well, by the end of the year, we should at least be able to have a quarter of our patients that are identified in the registry getting chronic care. So these would be examples of milestones. Under each one of these milestones, there will be activities. Obviously, when you're hiring a care manager, there are a number of things that need to be done for that. Such as writing a job description, going through HR, hiring you know, the interviewing process. There are a number of activities around that, but really the milestone is that you actually got somebody hired by a certain period of time whose accountability is managing that registry. So I'm going to stop right here because this is one example. I have several others that are a little bit different, but I thought maybe I'd take any questions about this particular one.
Do we have any
on the chat line?
Right now. So, yes. And folks, you are able to unmute yourselves if you'd rather ask the question out loud rather than chat.
Well, you must be doing a wonderful job, Dr. Stock, so please continue.
Sure, happy to continue. And what I would encourage you to do is type in a question as I go through some of these other examples. But I'm going to stop after each one so you can ask specific questions. And if this isn't making sense or you want to add something else, please feel free to pipe up. So the second example is another aim that I saw across many of the plans. And I don't know that this is specifically one that came from an organization, but certainly one that I saw in the plans. And one was to really increase the capacity to provide MAT services, medication-assisted therapies. So that's the what. The for whom, again, adult clients with opiate use disorder. Again, I like the idea of being clear about the age group. I mean, there may be some that want to focus just on maybe adolescence, maybe not this particular case, but maybe with some other condition. This is also one I added with a particular focus on pregnant women. You could probably have an aim statement that was just specific around opioid use disorder or substance use disorder in pregnant women, 18 and over, or maybe or younger. So again, being clear about what group of folks you want to intervene with or to provide care for is important. And then the by when is really dependent on what current services you currently have, maybe, or what you want to do going into the future. How much? Frequently, the increasing capacity can be measured in a couple of different ways. Certainly, looking at the number of patients, just the raw number of patients. Say you saw 100 this year, you want to serve 200, say, unique patients next year. Or you might want to just say, well, we just want to increase by 50% from baseline. Again, those are decisions that you all can make as an organization and know your setting and your context better than we know that. And in this particular aim, how much is the idea of adding specialty MAT services for pregnant women? It would be sort of an aim that was really kind of a milestone. It either happened or it didn't happen. And then finally, you can see the full aim statement. Next slide. So what was added, took a stab at some ideas of what milestones might look like for this particular aim. Hire or train an additional MAT provider. If you want to increase services, your current MAT provider is currently maxed out, then you know that you need to add another MAT provider by a certain time, and maybe even a second one at another time further down the road. A MAT care coordinator job might be a role that you want to develop with using these resources, and have a hiring date for that. The third bullet, milestone, is sort of a clinical practice MAT services system process. That's a mouthful, but at least to review what your current process is for getting patients into the practice and getting them those services, and then creating an ideal process and maybe even a pilot. What we've discovered in Oregon, we've been doing some of this work in this last year, and talking with clinicians, what we've discovered is that we have a lot of clinicians that are waivered to provide MAT services, but we find that they're not actually prescribing, and that for many of them, the barriers are the system processes in the practice. And so, beginning to address what are the barriers within the practice that could be overcome to help them provide more services. So I added that in there as a potential milestone. Pilot, so you can use pilots as you either say we're going to do a 1 month or a 6-week or 8-week pilot using this process, and it's going to be completed by a certain date. Again, that's a milestone. So you can see some of the other milestones. I'm going to stop there and just see if there are any questions about this kind of approach.
All right, I think you're good to keep going, Ron.
Okay, how are you doing on time?
We're doing great.
Okay. I just have a couple more. This the next example is actually more of a community-oriented approach, and I know there were a number of organizations that have a very strong community connection, and so wanted to add this. This is actually one that was taken off online in one of the AIMS statement sites, and it really is this one. The what is creating sustainable strategies to improve asthma prevention across the community. What I would say about this what is that you could probably replace that word asthma with a number of different conditions. So you could replace that with suicide prevention across our community. I know that there were some folks that were interested in doing that. You might replace that with obesity prevention, obesity in adolescence prevention. So you could sort of fill in the blank there in terms of prevention across the community. But this is an example of how you might think about, for whom, and what the location and what population you want to intervene with. The how much, you might include a number of different measures for that. This one, talks about staff training for asthma, or you could make it suicide prevention. The percent of public schools that have actually a designated professional that's trained in a particular area as a health prevention professional educator. You can look at the number of schools that you plan to outreach to. So it looks at this a little bit different, more in terms of a health population and prevention approach. And then again, taking that information from the four parts of the AIM statement, and then putting it into one statement that's clear to everyone. Next slide. And so there's some examples here is that for milestones, establishing a community work group, identifying a professional lead in each of the schools. Here's an example of, well, you might want to do a community-wide best practice prevention for across the communities, across all the schools. It might be a particular training session, but it's a milestone that you want to include. Pilot programs, say in a couple of schools, and so on. So, and I added one here around creating a registry. You could create a registry in some of the schools around kids that have asthma. So that you're prepared, at least able to respond to their condition if they're in the school setting. So this is another example of more of a community AIM statement. I'm going to go on to the next one, and then we'll end with any questions. So the last one is we've talked with many of you about establishing screening for social determinants of health. And so this would be an AIM statement around creating a screening process. Again, for whom, might be specific. If you're in a clinic or in a practice, you might see, you might establish this for either routine, or it might be for all new patients. So you want to maybe define that in terms of who actually gets the screening. How much is that you have some targets in terms of at least half of the people who are seen for routine preventive care will be screened, and that 100% of them who screen positive are actually referred to a warm handoff and care coordinator. I would just add that some organizations have added another how much in terms of how many actually show up or get interventions from a community care coordinator or referral to community resources. How many people actually go and meet that referral or actually take advantage of that referral? So that's another way of sort of testing or to evaluate closing the loop in terms of the referral. And again, then you can see the full aim statement for that organization. Next slide. So milestones for this might be, we know that there are a number of screening tools out there for social determinants of health. At some point, you're going to have to land on one, and that may take there may be some activities around evaluating that, but at some point, you need to select one validated screening tool by a certain date. That would be a milestone. It either happened or it didn't happen. You want providers to be trained, and that would include, staff, nursing staff, as well as clinicians, providing care. You might want to have care coordinators trained in the referral pathways. You might want to pilot test. Clinic screening and referral might be, the process might actually be finalized by a certain date. So these would all be milestones, things that you could say, okay, we did this, or no, we weren't able to accomplish it. So I'll just make one last statement here, and I noticed that I did not include, we didn't include any specific aims around the chronic disease model, and I'm happy to write up a couple to include in the slides if folks are interested in that. Those might include, particularly for the primary care clinics who likely already probably have done a lot of work in the primary care clinic around diabetes care, but you might write an aim statement around, reducing the number of diabetic patients that have hemoglobin A1Cs greater than 9, or you want to increase the number of folks that have hemoglobin A1Cs of less than 7. So you might write an aim statement like that if you're a primary care clinic. For other clinics or other organizations that might not be in primary care, you might want to have an aim statement that's related to that around, patient engagement or referral, that the number of folks that you're caring for, say for a mental health or a behavioral health condition that also have diabetes, that the number of those folks have been referred to a chronic disease self-management class, for example. Or have had some sort of referral made around your role in terms of helping them get connected with resources in the community. So there may be things around that, aims around that you could develop in the chronic disease and chronic care model piece of it. So I'm going to stop there. Shauna and Kathy, do you have anything, or Sharice, any comments, or we can open it up to folks?
Nothing extra from Shauna. Thanks so much. That was a great overview, and curious to hear if folks have any questions.
Well, this is Kathy. I think the one thing that I would add is to just be really, I just want to reiterate, being mindful about your milestones, because those are pieces that are going to be folded into your contract. You'll be held accountable to those milestones, and so it's a real balance of making sure that you've got milestones that are meaningful and going to help you move forward, but are also feasible and achievable, and you're not setting yourself up for failure. So it's making sure they're far-reaching enough, but making sure they're also practical and feasible. If they aren't far-reaching enough, you know, there'll be some back and forth with BHT before your contract can be something that feels good on both sides. If you make them too far reaching, you're setting yourself up for not being able to hit deliverables in your contract.
Great. Thank you, Dr. Stock and Shauna and Kathy. I think that was great information. Do we have any questions from folks?
I have a question about the template form. I see that there's 2 aim statements, and I'm assuming that the 2 different tables, the first one applies to the first aim statement, and the second table applies to the second aim statement. Is that correct? For the milestone tables?
Sure. So give me just a second because I don't have the template up in front of me. So we're going to take a quick peek, but that's a great question.
I think that is how it's set up, Cherise.
Okay, great. Thanks, Kathy.
And again, if I can just call out for folks that the table, I think it says activities and outcomes, but really as long as you've hit the requirements around, you know, you see the examples in the milestones, if you've written it right, the outcome is really embedded with the milestone, and it's really just a matter of yes or no. Did you hit it or didn't you?
So the 2 tables, the first table is specifically for 2019 milestones, and those are what are going to go into your 2019 contract. The second table is for 2020 and beyond, just so that we could and you could see a trajectory of activities and kind of be thinking ahead. But they will be reevaluated in the next year's contracting process. So that's the difference between the 2 tables. So your first table should reflect milestones that hit both of your aim statements.
Oh, okay, because I was getting the impression that our milestones for each aim statement would be different. And so we would have milestone specific to aim statement number 1 and milestone specific to aim statement number 2. But you guys are wanting us to mix them up in this table, the milestones for each of the 2 different aims.
Yeah, there may be specific milestones for each statement, and there may be milestones that cross over and hit both statements. So we really didn't want to prescribe any specific number of milestones per aim statement because it's really going to depend on what sort of activities you're doing. So yeah, they're not separated. If you want to specify which aim statement your milestone is supposed to be hitting, that would be great. But that's really not important to us to know.
Okay, thanks.
Yeah.
And we did have one question in the chat. And yes, this webinar will be on our Learning Cohort webpage, so you can access it and listen to it at any time you'd like.
I'd be curious if anybody would like to see some examples of some chronic care model aims and how you might think about that, or whether this is enough. What I would say is just if you think that you'd like some other examples, maybe just chat it into the chat box.
Yeah, we're getting feedback, Dr. Stock, that they would love to see some chronic care examples. So we will add those, no problem. Thank you.
Yeah, and I guess I would put a vote in that if you, as you're putting in your milestones into the table, that you be clear about which aim that does attest to. It's just easier for us that are reviewing it to kind of understand what the sequence. You know, it's the metaphor, the analogy was that, you know, this is the ladder and that there are rungs to the ladder, and it's helpful to understand sort of the sequencing of how you're thinking about accomplishing that aim, and these milestones are those kind of rungs of the ladder in order to reach that aim. So it's helpful to kind of see that sequencing of that, and it makes it a lot more, I think it creates a better story about that, and I think it will create a better story for you and your staff in terms of how you communicate that to them.
That's great. Thank you, Dr. Stock. And if at any time as organizations jump into their revised plan for January, if you folks have questions, please email us or call us. Hopefully you all know that we're pretty receptive to your questions and to your feedback, and we want to hear from you. We want you to be successful. We want this to be a positive step going forward for all of us, and so you just need to communicate and let us know, and we're happy to work with you. All right, Sarah, so we will keep moving on through the rest of the transformation plan, and then we'll have a few minutes at the end for any overall questions that you may have. So the next section is partners. And as we looked at the original transformation plan, this was an area where there was quite a lot of ambiguity, I would say, and we acknowledge wholeheartedly that you had a very short time frame in which to work. And we also understand and acknowledge that relationships and partnerships are always a work in progress as you go forward. But if you have made any sorts of headway or develop new relationships, have new partners, we would love to hear that. And we are looking for more concreteness and specificity, and so even if you are in the developing stage of what that partnership is going to look like, please let us know that, and then what those anticipated roles and what that relationship will look like. And then again, just kind of finishing out through the rest of the template, in many ways it mirrors your original template, although much shorter and revised. So again, looking at the chronic disease management, identifying those areas that are directly related to the work you are proposing in the plan. And then as we move forward, the opioid use and abuse, we did try to do a simpler format for the opioid section than in the previous template, and I think you'll hopefully see that. And then we also included, and this is new in regards to the transformation plan, but we are including the pay for achievement measures. And if you haven't seen those pay for achievement measures, please click on the link and take a look at those. But this will give organizations and providers an opportunity to pick measures that align with the work that you have already planned. And these are measures that really support transformation work, and I think you will find that a number of them go hand in hand. Actually, all of them go hand in hand with the work you're already doing, and will just, again, strengthen that foundation and give you an opportunity to earn some additional pay for achievement measures. And at any time, please let us know if you have any questions about those as well. So technical assistance needs, and this is really applicable to the learning cohorts as we go forward. And we use our champs, our provider champs, for a lot of feedback, but at any time, if an organization or a provider wants to give us feedback or, offer assistance or, just address gaps in the system of care, we would love to hear that, because we really do want to make this applicable to you. Is our intent to strengthen our system of care and our provider network, and that is the foundation from which we are working. And so we need you, and hopefully, again, you find us very open to feedback when you have it. So again, help us help you. And then we get to the budget and budget narrative, and I think you will find that this is a much simpler template than what you submitted the first time. It's again, the details about the amount of funding that is eligible for providers to earn, please click on that link. And if you have any questions about submitting the budget or the budget template, please let us know, and we're happy to do that for you. But it is much revised and shorter than from the original transformation template in general. And I think with that, Sarah, are we to just general overall questions? So please, if you have anything you'd like to know, just let us shout it out.
If we didn't have any comments regarding the budget, do we need to redo the our budgets?
Redo meaning, can you just say a little bit more about that? I'm sorry.
Well, we submitted our budget in the original template. And so if we didn't have any comments regarding the budget, is there something that we needed to update or?
So Cherise, can I jump in for a second? Just because I want to call out for folks that in the first version of your transformation plan, there was really no guidance as far as budget in terms of, you know, size, scale. And now the BHT board has approved maximum potential funding for providers based on size. So I think the only note would be, you know, there weren't many comments on budget in the first iteration simply because the budgets were really broad, and now you've got more specificity about the potential maximum investment that you can get from BHT to support this work, and so you'd want to have your budget reflect that amount as opposed to something else. And if what you did in the first pass fell into that amount, then there's not much additional work you would need to do. But I suspect for most of the partnering providers, they will need to redo their budget simply because they have an amount to work with now and they didn't before.
So the budget would be balanced against the amount that we maybe, our maximum amount that we could get?
Yeah, I mean, I think it's, you know the amount that you could be getting now, and before you didn't. And you might want to put forth a budget that shows, well, look, we're going to be putting in X, Y, and Z from other investments, but here's our intention around the dollars we anticipate getting from BHT.
Thank you.
Any other questions that folks may have?
What I would say, Cherise, just to comment a little bit about this last conversation is that, you know, the thing about the milestones, the aims and the milestones is that what I would expect in reviewing is that it would be pretty clear about how the funding is going to be used to accomplish the milestones. And it might, so I'd encourage folks that where it's pretty obvious, maybe in the narrative, just to point out that, you know, we're going to hire a care manager, or, you know, and we're going to use this money for that. That's why we're doing that. So that there is some connection between what we see in the milestone. I mean, it sounds pretty self-evident, I know, but sometimes it's not so clear. But that's where the narrative can help, you know, point out, at least confirm that your the budget reflects what you want to do with your aims and your milestones.
Okay, folks. Gone. I think we don't have any, no more questions in our chat. Again, we will be posting this on our website, and if you have any questions, comments, or concerns, you know where to find us, and we're always open to your feedback. So I just want to give a couple more seconds for any final questions, and then we'll let you get on with the rest of your day. Okay, I can see people starting to jump ship. So I thank you all very much. I know this is probably not the way you wanted to start your year off, but we're always happy to have you and always happy to support your work as you go forward. So thank you very much for joining us. Thank you, Dr. Stock, Kathy Kaufman, and Shauna. We absolutely appreciate you joining us and offering your great insight. And again, just let us know if you have any further questions, and we would love to have your transformation plans into us by January 31st. So thank you all very much and have a great day.
Thanks, everybody. Bye.
Thanks, everyone.